Hi, Mr. Smith. My name is Catherine. I'm going to be your nurse today. Can I have your full name and date of birth, please? Mr. Smith, okay. What's your date of birth? Perfect. And I'm double checking, and it perfectly matches your bracelet. So today what we're going to do, I'm going to withdraw blood from your central line. I'm going to change your syringe cannula, so your caps, and then we're going to change the dressing of your catheter. Is that okay with you? Perfect. So I'm going to go gather my stuff, and I'm going to be right back. Okay? So the next step would be to clean your working area. So once you have all your material ready on the patient's tray table, you can bring it to the patient's bedside after performing hand hygiene.
Determine which lumen will be used for procurement. Draw from proximal lumen or large lumen if possible. Open the two 10 ml pre-filled NS flushes. Remove air from syringe. Attach one syringe cannula. Leave cap in place. Make sure not to touch the tip of your syringe or the cap. Put on clean gloves. Stop all IV medication via all lumens. Unclamp the lumen that will be used for procurement. Connect the Vacutainer lure adapter to Vacutainer 1 use holder. Be careful not to contaminate. Scrub the injection cap with a chlorhexidine alcohol swab. Use vigorous friction for 15 seconds. Let dry. Insert Vacutainer lure into injection cap and twist a quarter of a turn. Fill blood collection tube that will be discarded. Verify this step according to hospital policy to know the exact number and what kind of tube to discard. Then you can fill the blood collection tubes you need in the order according to your hospital policy. Gently invert the blood collection tubes 5 to 10 times. Clamp the lumen and detach the Vacutainer holder. Scrub the injection cap with the new chlorhexidine alcohol swab. Use vigorous friction for 15 seconds. Disconnect the tubing, ensuring not to touch the connection. Tear open a second antiseptic swab, remove it from packaging, and then scrub around the female end of tubing of catheter with the chlorhexidine and alcohol swab. Make sure to not cover the open end. Continue to vigorously scrub the connection for 15 seconds, including the creases. Allow to dry completely 10 to 15 seconds. Do not fan or blow on the connection to accelerate the drying process. Connect your syringe with the cannula or cap and flush with 10 ml of NS using stop and go motion. Finish with a positive pressure at the last ml. Disconnect the syringe and get your second NS syringe. Connect it to your cap and flush the remaining 10 ml. With the stop and go motion, and then clamp with the last ml of NS. Assess the catheter insertion site and trajectory of the CVED under the skin for redness, edema, warmth, and drainage. Gently palpate for pain before removal. Patient and nurse need to wear a mask. Ensure the patient is comfortable and arm is resting on a flat surface. Secure extension tubing with paper tape on the arm or upper arm. If skin is visibly soiled, open sterile dressing tray and pour NS in the section of dressing tray. Don non-sterile glove. Remove bottom part of the dressing. Holding the catheter in place, gently remove the dressing starting from the lower end of the dressing and moving toward the catheter insertion site. Remove dressing slowly and remain as close to the skin as possible. Using the chlorhexidine 2% and alcohol 70% swab sticks, apply antiseptic to an area larger than the size of the dressing following these 3 steps. Step 1. With one side of the swab stick, clean the top of the catheter from the insertion site to the hub or up to the section of the catheter that will be under the dressing. Step 2. With the second side of the swab stick, working with a back and forth friction motion, clean around and over the catheter for 15 seconds. With another swab stick, for step 3, working with a back and forth friction motion, clean around and under the catheter for 15 seconds. Allow disinfectant to dry completely before applying dressing. Chlorhexidine 2% and 70% alcohol takes at least 60 seconds to dry. Open peelable package of Cavillon. Apply the Cavillon to cover skin that will be covered by the dressing. Do not apply on insertion site. Make sure to let dry. Now we're going to apply the transparent dressing. Remember to not stretch the dressing when applying on skin. Place the middle of the window on top of the insertion site. Apply the window part first, then apply the remainder of the dressing. From center of the dressing outward, firmly smooth down entire dressing to ensure all edges have adhered well. On the label provided with the dressing, write date and hour of dressing change and nurse's initials. When you're done, remember to document in the medical record the assessment of the insertion site and the trajectory of the catheter, the length of the catheter from the insertion site to the junction of the tubing and cup visibility, the dressing change procedure, and the integrity of skin.